pleasure to meet you. How can I help you today? Okay. How long has that persisted for? Okay. Okay, so if you want to talk through your symptoms with me. Okay, so no, we will check your heart rate and blood pressure, not to worry. Have you been checked lately for lice or anything like that? Have you got really itchy scalp? Okay, we'll maybe check scalp as well. Okay, we can absolutely check your body for any lumps and bumps. And if you're getting pain in your jaw as well, maybe have a look at your teeth. I know I'm not a dentist, but in case there's an ulcer that needs treated with antibiotics, I can refer you to the right person. And we'll maybe have a look at your eyes as well if you're saying you're getting visual disturbances. Okay, any other symptoms? Alright, so let me just make sure we have the right patient here. Can you confirm your name and date of birth? Perfect. And the first line of your address? Perfect. Postal zip code? Great, and I don't think we have this on file. What's the best contact number to get you by? I'll get the receptionist to add that onto your file. Great. Now, you are a new patient, so I don't have any of your previous medical history or medications you're taking. So can you just confirm if there's anything you've been diagnosed with that I need to be aware of? It can be in the past that you no longer have, just anything relevant. Okay. Right. Okay, anything else? And medications that you're currently taking. How often is that? Okay. Yeah. Okay. Alright. Every other day. Okay. Anything else? Okay. Alright, let's begin our examination today then. We're going to begin with your heart rate and blood pressure check. So if you could just lift your top up for me, and we will listen into your heart for a little moment. Just make sure this is nice and warm for you. Okay, just lift that up, thank you. Are you feeling a little bit stressed today? It's normally white coat syndrome. Yeah, your heart rate was up at 110. That's okay. Yeah, average is about 80, but a lot of people have elevated heart rates when they go to the doctors, but it sounded fine to me. The variability and the beats were fine. Just what we listened to. Okay, I am just going to put this blood pressure cuff on you. Now, do tell me which is the best arm to put this on. Your left, okay. Just slide around in there. Excellent. Okay. Alright, we're just going to do this 3 times, okay? To get average. Okay. Okay, and final time. Alright, that's great. So if you just slide that off for me. Yeah. And I'll push the air a bit. Your blood pressure was fine. Yeah, it was 122/76, so pretty close to average. We look for 120/80 average, but there's a variation in what's normal, so 110, and then we said 122/76. Okay then. Now, our next step was to check your scalp for lice or any other skin conditions, alright? So I'm just going to put my gloves on. And we'll get checking. I'm going to start with this side over here. I'm just going to use these tweezers and gently look in here. So where did you see most of the itching is? Let me see. Okay. much pressure, is it? This side. Alright, but there. I don't think there's any lice in there. I think you've got a little bit of scalp psoriasis, mainly on this side here, so we can give you a topical shampoo to help with that, okay? Yeah, no lice there. So that's fine. Alright, and then you wanted a body check for any lumps and bumps. Right, just do that in a second. Just take a little drink. Alright, let me have a look at you. So we're just we'll fill your head first. issues with any lumps and bumps? I hope that makes you feel better. Yeah, let me just look at that arm. No, that one's fine. That one's fine as well. Right, so as I said, the next step is I'm going to look at your mouth, okay? This ulcer that you're referring to. Okay. Okay, can you open wide for me? So So, I do think this is slightly inflamed. Okay, so I'm going to give you a course of amoxicillin. Alright, I think that's probably what's causing you the pain. So we do have an ulcer. So I'll give you a course of amoxicillin. Yeah, it's 5 days, 3 times a day. And you'll be able to pick that up from the pharmacy. I'll give you a script for that. And then if you have any other issues with that, I would recommend you go to your dentist. Okay. Alright, now let's check those eyes since you have been having visual disturbances. Okay. So you look up for me. Down. Look to your right. And to your left. And back up. And to your right. And to your left. Okay, I'm just gonna check your pupils. Response delayed. Okay. Alright. Okay, I'm gonna hold this Snellen chart up here. You don't wear glasses, do you? No. So let's check your visual acuity. So starting by the top, just read all the way down for me. E L T F that was excellent. Okay, no real concerns there. I'm just going to cover one of your eyes each at a time, and I want you to tell me when you can see my fingers in your visual field, okay? Just go over this side. Okay. 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 Great. And other eye. Okay. Okay. Okay, excellent. Good, and then I want you to pay attention to this. Actually, we'll use another one. We will use... so you can see it clearer. This one. So, I want you to focus on this, and just keep focusing on it as it comes closer to your eye. One more time. Great. Okay, eyes are cleared. So, the only thing that's flagged up here really is your mouth ulcer. And also the psoriasis. So actually we will get a script as well for the special shampoo for your scalp. So I'm just going to also scalp shampoo and amoxicillin. Okay. So if I prescribe that, it should hopefully stop the itching with the scalp and should help clear the jaw pain. You're likely just getting the visual disturbances from the pain. Is all probably all connected if your jaw's very sore. Yeah, and then your scalp's itchy. As we said, there's no heart rate or blood pressure concerns. Sometimes if you've got high blood pressure you will get visual disturbances, but it doesn't appear to be that case in your case. And there was no lumps or bumps or anything of concern that I found today. And then your eye test was clear, so I couldn't see any additional floaters. I couldn't see any issues with your reaction times and your pupils, and obviously your visual acuity has not been compromised at all. So I do think it's just a case of needing that scalp shampoo, a little course of antibiotics. Do also make sure to take some probiotics as well, because when you use antibiotics it does clear out some of the good bacteria, especially in your gut. So I do recommend getting a good little supply of probiotics. You can get them in tablet form, you can get them in yogurts, there's lots of options out there. So just make sure to replenish that good bacteria, otherwise you might find some stomach upset, and also it can lead way to yeast infections and things like that. So alright, well that is you. If you're happy with that, then that's us today. So take that script here, that's it, just take that to the pharmacy, and of course I'll get your number updated on your file as well. Any other issues at all, just phone the receptionist for another appointment, okay? Alright, take care.